Hey guys, this is Doc Tony again with Crooked Spine Show. We're here with Aimee. But our biggest thing today, I want answered is if not myself, but if a mom, if a husband and wife, if a mom wants to get or a lady wants to get pregnant, and how does that process work? We know medically it's kind of up to you, right? We've heard everything left and right, what to do, what not to do, the best chance of getting of being fertile, even in vitro, to how that works out. I want everything answered in one interview with Miss Aimee because she's my expert. Okay, she's done it for a while now. She's helped a lot of moms, even husbands, to understand the process of getting pregnant, what in vitro means, and also do the process of getting to actually a healthy baby birth, how that works. So, Aimee, take it over. How do you get into this field?
Yeah, I'm actually a certified physician assistant and have been working
Mhm.
in conventional medicine for about 10 years. And functional medicine kind of found me, and I'm so
Okay.
grateful for that. I worked in many different fields, but then found I was always kind of lacking in some ways of trying to meet all the needs of patients and trying to bring the entire picture and entire health together, mentally, physically, and emotionally, in the way that I thought would serve them best. And so once I found functional medicine, it really, things took off. I felt more aligned in what I was
Mhm.
doing. And so then I continued on my coursework through the Institute of Functional Medicine, Dr. Aviva Ram, integrative and functional medicine for women's health. I've continued coursework all the time. And so now I see patients or clients all over the world, working with them to really boost their fertility, to
Mhm.
optimize their chances of conceiving, decreasing any of those problems that might come up, and really focusing in on unexplained infertility. I think that just needs more work and another lens perspective to really figure out what's been going on for that unexplained infertility issues.
And when you say unexplained, the way I interpret that is basically the unknown, which can cause anxiety in anybody. So at that point, I'm guessing at this point, and if I'm guessing, my chance become less and less of one thing, getting pregnant, but also having a comfortable pregnancy and a comfortable delivery, and obviously a healthy baby. Correct?
Absolutely. You know, over 80% of women who struggle with infertility also struggle with anxiety. And so
Mm.
that mind body connection is so huge. So
Mhm.
both are going to impact the other negatively as things go on. So, yep.
And that's my biggest thing when I treat someone who is pregnant in that process of having a baby. I basically tell them as a chiropractor, hey, my job is to lower your stress level in your body so you can have a healthy baby. Because if you're stressed, those nerves connect to your baby, make your baby stressed also. Then we're gonna basically go down a roller coaster ride.
Yeah, absolutely. And then you get the epigenetic effects from that as well.
Mhm.
And so it does carry off onto their offspring too. So studies show, when we go back to different famines, right,
Mhm.
our whole gut microbiome changes based off of those people who went through those famines, because we're going to hold on to more calories. So when we're also going through a lot of anxiety or traumas while you're pregnant, it does carry over into your offspring as well, and it impacts their overall health. And so things that we do preconception as well as while we're pregnant plays such a massive role into the overall health of your offspring too. So it's
And
fascinating.
getting into and as a specialist too in this field, what do you see lacking in the medical field right now that you want to fill that space?
Yeah, great question. I think as far as the current medical field, you get your set of labs, and if they're
Mhm.
normal, quote unquote normal, right? They say, hey, come back in a year. Or if you've already been trying for a year, if you're under 35, or over 6 months, if you're over 35, then they say, okay, well, you can do IUI, we can do IVF, you can go ahead and start on
What is IUI
medication.
and what is IBS? So some people may
Yeah.
not know.
So, yeah, totally. So, intrauterine insemination, and in vitro fertilization. So, taking the egg, inseminating it, and then reimplanting it. So, these are big, expensive things that are really
Mhm.
disruptive to a lot of couples, their lives. They're having to constantly go back to the doctor's office, take hormones or medications to really boost their egg quality. And, you know, it's very anxiety inducing for a lot of people where, you know, I think that you can do a lot beforehand to improve your chances of conceiving, to really optimize your egg health, optimize sperm health with a lot of lifestyle factors. I know some people, like some of my clients have done IUI or IVF previously, and then they come to me and saying, you know, it's not working. What can we do? And I'm like, what recommendations did they give you? Did they go over anything nutrition wise, lifestyle wise, anything like that? And they say no. So they just leave so frustrated. And it's not to bash doctors, providers, having been in the conventional medical role, I understand what they're faced against as well. But it is lacking to your patients. And, you know, when people want to get pregnant, they wanted to get pregnant yesterday. So when they're
Well, they're
trying
being told also,
to
like you had said, going do the in vitro artificial insemination. Let's do that route because, and it's assumed there's something wrong with you,
yeah,
something wrong with your body where you can't do it on your own. So that
yep.
assumption would make someone feel deficient. Okay, now I'm desperate. Now I have to go this route and spend thousands of dollars to maybe try it once, twice, three times a lady to make sure at that point things might work. Again, this is all might, maybes, not, hey, this is a higher chance because
Mhm.
you're saying there's nothing wrong with someone until you've gone through the lifestyle changes, correct?
Yeah. Yeah, certainly. You know, there is so much that you can do beforehand and really looking into it, you know, versus saying, okay, your hormones look okay, but have
Mhm.
they looked at gut health? Have they looked at your detoxification pathways? Have they looked to see what your stress levels are on the daily? How are you sleeping? What kind of exercise are you getting? Or are you over exercising, right?
Mhm.
Even, you know, body weight, is it too low? Is it too high? What are your blood sugars like, right? Do you have insulin resistance? And that's going to impact your ability to conceive. So, you know, what's your thyroid health looking like? I had another client who she actually was seeing a reproductive endocrinologist, her OBGYN, her TSH was quote unquote normal. And so they just stopped. Where we dug deeper, we really looked into her overall
Mhm.
thyroid health, and it was the major issue that was causing her problems. And she went 6 years of trying to conceive. We worked on her thyroid health, got it optimal, and she got pregnant before she started any other medication. So I think there's so much that you can do besides just saying, just jump to these expensive medications, jump to these invasive procedures. You might need that, right? I wish I could
Mhm.
guarantee that, just
Yeah.
like anyone who's doing IVF, you wish you can just have that for sure. But at least you can optimize your body, optimize your mindset, improve your overall health. So that way, if you do get pregnant, you can have a healthy pregnancy and a healthy baby and a healthy postpartum period too. So decreases all of the postpartum depression that you may go have too.
Well, that's the thing is when we think about, okay, am I healthy enough to have a baby? Your doctor will not ask you that, you know?
Yeah.
So you're almost going, if you depend on just that and not look outside the doctor's office, you're almost putting yourself at deficiency of not only knowledge, but your due diligence as a person, bringing another person in this world, correct?
Absolutely. Yeah.
Mhm.
You know, I think the assumption is yes, you know, if you can have a baby, you're healthy, right? Or
Mhm.
if you can't
Exactly.
have a baby, you're unhealthy, or, you know,
Yes.
you just need to go ahead and take this medication, where it's not really the case, as we all know.
When medication, especially being hormone medication too, does that re-regulate your natural system to now change in a positive or negative way?
Not necessarily. I mean, it's artificial, right? So just like taking birth control for your hormonal irregularities, right? Most people actually start taking birth control other than for contraception. They're taking it for because they've got some sort of hormone issue. When you start on the birth control, right? Yes, that's going to help fix it. It's going to improve your symptoms, but it doesn't fix the problem, right? When you get off birth control, you're going to have all of those same issues that you had previously. They may actually be worse because now you've depleted nutrients that you needed before. And so, same thing, you know, while if you're taking Clomid or other hormones, right, it may help at that instant, but it's not going to always be improving your overall hormonal health.
It's almost like you're taking something artificially or in addition to your normal body's production. At that point, you're going, okay, now if I have that, there might be side effects, but if I don't, if I'm not on it, now my body's self-regulating to make that part of my normal I want to say it, diet or intake, at that point, if you take it away, now your body's going, okay, now I'm deficient. So you've
Yeah.
made your body now dependent on it and per se, correct?
Yeah. And a lot of it does deplete other nutrients while you're at it too. So then we kind of get behind the 8 ball even more than we were previously. So
And walk me through your assessment. How do you assess, say, a new client, a new patient for nutritional, where they are nutrition are deficient, are they in excess? How do you work with that?
yeah, so I have everyone actually do at least a 3-day dietary log and being super honest about it. There's no judgment, right? And not everyone has perfect diets. Most people have the standard American diet. It's a SAD diet for a reason, right? We're not getting the nutrients that
I
we
love that.
need.
I love that abbreviation, sad diet.
No, right? So the things that our society focuses on as healthy might really be depleting your nutritional status. So I look at lifestyle, look at what their sleep is, I look at what their diet is on a journal log. And then honestly, after that, once we get a big history, all the lifestyle factors that have gone on, the traumas that they've gone under,
Mhm.
how many antibiotics have they been on as a kid? How many ear infections did they have? Because that's going to impact your gut microbiome, which impacts your hormones. So
Oh.
looking into all of these in a much deeper level, and then, deciding, okay, what lab tests have you had done? And now what additional lab tests do we need to do? So oftentimes I will do a nutritional lab testing as well to see
Mhm.
exactly where you're deficient, what's going
Mhm.
on, going back to that Krebs cycle, what nutrients are needed for your mitochondria to function properly, for your cells to actually be healthy, because we know that with your egg cells, your oocytes, they require the most mitochondria as well and the most energy. And so we really need to be honoring that and giving your body what that needs.
You almost need to go, okay, is your body efficient in its minerals and vitamins, oxygen content, everything else your body needs to function as a healthy person? And then adding this now to bringing a baby in the world and conceiving, that takes a higher level of where you are now to make your body now conceive and go through a healthy pregnancy and healthy delivery.
Absolutely. And I think that's where a lot of issues, even in pregnancy and then postpartum, come from, right? Because
Mhm.
pregnancy requires so many additional nutrients. And it's a stressful thing to undergo. And so if you're behind the 8 ball before you even get started, right, then you're going to have more issues down the road as well. And, certain studies are showing too, it increases risk of autism in your offspring
Mhm.
too, as well as ADD, ADHD. So focusing as much as you can before you actually get pregnant is going to be the key.
You're almost making sure your body is at a health peak, I'm going to call it, to where because your nutrients you're going to have in your body will have to go to your baby as it grows, that develops. At that point, if you're deficient, now your baby's starting out in a negative or deficit in those minerals and vitamins that can help it to not only grow but also develop for the first say 9 months. That's going to be that's so it's rapid. You can either cause a deficiency that can be long term or even short term that you may not even know of until your baby's born, even down the line when they get tested in school, for example. So you're trying to set yourself up and the baby up for a lifetime of being healthy, at least from that perspective, correct?
Absolutely. You bet. And then,
So,
the epigenetic effects too. So, not even just in your lifetime, but what is your kids? So, your offspring's offspring. What are you doing for their health? So, it's amazing when you start to look at it, you kind of pull things back and the layers back even more. And you're thinking, okay, what I do right now is going to impact my kids' kids. That's a next level, right? Like we want to do what's best for our kids, but then when we start thinking about your grandchildren and okay, what can I do now? And it's fascinating that there's a lot that we can do that's going to impact our epigenetics, our offspring down the pathway.
and explain epigenetics. Some of my audience doesn't know what that means. What is epigenetics? How would you define that for layperson?
Yeah, so epigenetics is going to be what we do. So your genetic material is going to get passed down to your kids. But,
Mm-hmm.
as far as if you're female, you have all the eggs that you're going to
Mm-hmm.
have, right? And you had those eggs when your mom was in your grandmother's womb. So when
Crazy to think
you
about that. Wow.
Right? I know. And so knowing that, okay, so my genetic material is from when I was in my grandmother's womb and what's going on. So what your grandmother did during her
Mhm.
pregnancy, what's happening is impacting you now 2 generations down. And same thing is going to happen when you're pregnant or whoever's pregnant. That's going to impact your kids transgenerationally.
So it almost you're trying to set yourself up as much as you have to give your child, so your child's next generation doesn't have deficiency based on your due diligence today.
Yep.
Wow.
And that's where traumas and certain things, like if you've undergone traumas, that can really impact your offspring's offspring too. So,
So you almost want to go into not only the physical health of having a healthy physical body, but also a physical or a mental health, if you want to call it assessment, and trying to stay as healthy as possible from a psychological point of view.
yeah.
How do you
And then,
test that? How do you assess that, the mindset, the mentality?
yeah, so there's definitely different questionnaires that we can go over with all of our clients too. And we work with clients between 4 to 6 months because really, in order to optimize egg
Mhm.
health, right, from your primordial oocyte, you need at least 4 months for that. So what I'm saying is what you do right now is impacting the egg that's going to get fertilized in 4 months from now. So you need at least 4 months at the very least to really optimize
Wow.
your egg health and what's going on. So planning, right? People plan for months or years to get married and then they decide to have kids and then they're like, wait, I want to get pregnant. Why am I not pregnant? Where if you
Mhm.
actually were able to do a lot more planning like you did for your wedding, you actually might optimize those chances even more. But so we want to be looking at what's going on in that window to really help improve your chances of conceiving and the health of your offspring at that point in time too.
I realize it takes about 4 months for your body to reacclimate and get to a healthier state to allow that conceive probability to increase higher and higher. Wow, that's
Mm-hmm.
crazy. Not like yesterday. Like, yep, we're good. No, it doesn't have that way. No.
I know
And
we all want
again,
it to.
I mean, I have in my background. All my kids are 19 and over, so I've been done for a while. But
Yeah.
a lot of someone who's a new mom, they go 4 months. I had no idea. Your doctor will not tell you that. So having
Yeah.
that realistic time frame gives someone, okay, now I have a window. There's no rush, but let's get my body, my labs work right, my mind right, my long term goal right. So now I go into it, and my conception is going to be as healthy as possible, not only for me, but for my kids' kids.
Yeah.
Crazy. That's like not only big, it's like the big worldwide picture. Crazy.
Right. I know. It's so
And
true.
how do you go now to switch? How does the husband, the sperm, I guess, health also involved in the process of what you deal with when you deal with couples?
Yeah, certainly. Very important as well, right? So, when it comes to, I always like to describe it as fertility struggles, right? I think the term
Gotcha.
infertility, I think it means like there's nothing that you can do, right? Where I think honestly, if a couple, they're 33, they're 34, and they've been trying for 10 months, and they go to their provider and they say, hey, we've been trying for 10 months, and they say, well, try for 2 more months. Like, that's really discouraging, right?
Ugh.
So, I also think that within that time frame of clients that you so much that you can do as we've been talking about. Sorry, what was the question again? I apologize.
Well, a lot of for the men
Oh
perspective,
yeah.
as a couple struggles, how can the man get himself ready to give the best? I'm going to call it sperm to the for the conception.
Totally. Just like for women, it takes about 4 months, 120 days. It takes about 90 days for sperm to actually be their healthiest as well. And so, even though you're making sperm all the time, um, from its onset until what is actually produced, it does take about 90 days. So there's a lot that you can also do. I know that when we talk about infertility, everyone thinks, oh, it's a women's issue. It's about a third female, it's about a third male, and about a third combined factors. So it's usually not the man who's coming into the doctor's office saying, what do I need to do? It's the female who's probably dragging her partner into the office saying, we need to
I
work
thought we are
out
going to
this
lunch, babe.
well.
What happened? This isn't lunch. This is a doctor's office. What's up with this? Suckers in the
Exactly.
game. It happens all the time to us.
So much that they can do too, right? Because same things that impact the egg cell impact sperm cells. So oxidative stress, nutritional, thyroid, actually. So even with men's thyroid, that can also be a major contributing factor for miscarriage in
Mm,
women. So we need to look at all of those things too.
mhm.
And so for women who are having recurrent miscarriages and their husbands haven't been checked out yet, it certainly is, they need to have their husband checked or their partner checked, because that could be a major influence on actually why they're having recurrent miscarriages too. So other things that they can do: reducing stressors overall,
Mm,
again,
okay.
working on sleep, working on exercise, cutting down on smoking, marijuana, alcohol, all of those
No more
things.
crack.
Again,
No more crack.
no crack.
Got
So
it. No more
all
crack. Cut
those
it off.
things, they're like, oh, the wife can't drink, the woman can't drink, but I
Yeah,
can drink for both of us, right? It really impacts sperm health too. So,
that's not
um,
good. Got it. Okay, got it.
yeah. Yep. Cell phones in
Okay.
pockets, right? You don't want to do that. The radiation as well is going to impact overall sperm health too. So there's a lot that can be done, and a lot that you can improve upon too. Again, that mitochondrial health for the sperm too is going to be really important.
And taking one step back for the sperm, how's the sperm, if you want to call it, get healthy from a healthy guy's diet and also lifestyle too? How is it, I
Yeah.
guess, formed or developed?
Yeah. Same thing. I think it's in our general conventional medical model, we always think of things as separate, right? So if you have
Hmm.
issues with hormones, you go see a gynecologist. You have GI issues, you go see your GI doc, right? If you've got joint pain, you're going to go see. So within this realm, we can see, like, okay, what you're doing lifestyle wise is impacting your sperm health. What
Hmm.
your gut health is doing, right? What your gut microbiota, it is also going to be impacting your sperm health as well. And so all of these things, whether or not you're getting the antioxidants that you need, or you've got so much oxidative stress, meaning so much stress that your body can't handle, and clear it out, it's going to be impacting the sperm in a negative way too. So all of these things are so interconnected, and that's why I want to look at everything as a whole instead of these
Hmm.
pieces of the whole, and focusing on, all right, if XYZ is negative or normal, you're fine, right? Or there's a lot more that we can do. Or if one piece is off, not just focusing on that one piece, but why is that off? What else is
Hmm.
going on upstream from that to make that be off to begin with, right? Instead of just slapping a band-aid, or saying take this medicine. Like, why is that changed to begin with? How do we fix that? And if why was that also out of balance previously too, and how do we fix that? And so you just keep going up and up, really figuring out where the metabolic chaos is, what's going on upstream from the either symptom, or the abnormal lab or sperm, or morphology. Mhm.
It's almost going, okay, how do I make my, again, back to a healthy, if this is off, how do I go to the root cause of the problem being maybe my lifestyle, maybe my stress levels, maybe my things. But sitting down with you, Aimee, allows them to now not guess, but okay, let me go through with Aimee what I'm going through and see how we can backtrack of where the root problem might be in my body, so I can develop and generate healthy sperm as a guy and have healthy eggs through that process of development. So then things from the beginning become good, not just a guessing game all the way through. Correct?
Absolutely. Yeah. So, you're looking at, like you said, all the lifestyle factors.
Mhm.
And then I do functional testing with my clients as well. And where we are looking at what's your gut microbiota, what's your gut
Okay.
microbiome looking like, more in depth for women,
Mhm.
female hormone testing as well, to seeing what's going on every day throughout your entire cycle, what's happening, right? So that's going to
Good.
be a key thing too, instead of just getting a maybe 2 day, a day 19 to 21 progesterone, a day of 3 estrogen. So really looking at things throughout the entire cycle. Like I said, looking at those nutrients, those micronutrients, and where you're deficient. That's going to be so key. So
Do you recommend
detoxification
doing
pathways,
a
everything.
male hormone test also too, a male hormone test, or just the female test?
Yep, male hormone as well.
Why? Why? Because men don't have testosterone. So I know why, but why would a guy go, well, why would I get tested?
Yeah, because that's going to definitely impact your overall sperm health as well. And so we want to see too, what are your estrogens looking like? What's happening with your testosterone? Where are certain part of your testosterone getting converted into estrogens? What are your adrenals like as well? What's happening with your cortisol curve? Because all of that is going to impact, your sperm and optimizing your sperm health.
Even beyond that too, looking at the guy's health in that direction, that way to look at it objectively allows them to go, hey, look, if I'm living a healthier life, wow, then maybe I'll have less chance of cancer, less chance of having long-term health conditions, because now I've had everything tested. I'm a less risk of having health problems as my future kid grows up and with a healthy dad. Hey, what amazing.
Absolutely. Yeah. Again, it's not just like fixing one problem, right? It's trying to optimize overall health. I think so much of medicine is just fix what's placed in front of you, and we'll see you if we see you, right?
You're
Versus
breaking
saying,
down the little things that people don't think of because they would know because they were never told this before too. Going through the pregnancy process, say the 9 months, how do you help couples deal with those struggles? And what are those struggles?
so during those 9 months, certainly the metabolic changes during pregnancy are going to change, right? And the needs of maternal nutrients are going to be changing throughout pregnancy. So making sure that those are all getting met. And really, if you're doing the work beforehand, then you're setting yourself up for a successful pregnancy, right? So we're going to be decreasing your chances of intrauterine growth retardation. You're going to be reducing your chances of having gestational diabetes or premature delivery, right? You're going to be reducing all of these chances of hypertension and things that can really complicate labor, delivery, and postpartum period. So by really focusing on the foundational changes, that's going to improve your chances of decreasing these other problems that can happen.
You're like you said, this is a if you want to call it domino effect, where if you're starting out even the 4 months before you want to conceive and that healthier state, it's going to trickle down to everything through the pregnancy, even beyond that too. Correct?
Absolutely. Yeah.
Good.
Yeah.
Is there a lower risk of postpartum depression once you've gone through this process with you too, Aimee?
Yeah, I think so. I really do believe there is. Again, a lot of our neurotransmitters are formed in our gut, about 70 to 90%. So our
The second
serotonin,
brain, right?
dopamine,
Second brain.
second brain, right? It really should be the first brain. It was formed first, and there's more neurotransmitters there than in your brain. And so, really, when we start working on things that are going to improve your overall gut health, improve these stressors, right? When we learn how to manage stress, we can take more things off our plate. That's going to also begin to decrease that anxiety, the depression that you might experience afterwards. Oftentimes postpartum depression is due to thyroid issues, and it gets pushed off and said, hey, it's just normal part of having a baby. Of course you're exhausted. Of course your hair is falling out. Of course you're hormonal. You're crying. You've got no energy. You're constipated. And like everyone just says, hey, it's just part of having a baby.
It's normal.
Check the thyroid, see what's going on. So if we optimize thyroid health beforehand, and educate. So empower women and empower couples to really take charge of their health and their fertility. And so then that way, if they do happen to have those issues, they can say, hey, this is not normal. And can we look into this deeper? So, yeah.
It's almost you're giving someone the tools to become their best doctor on their own, to take care of their own body. So at that point, they're not going to, well, the doctor said this, or my aunt said this when she had their kid. You're not going off someone's information because you have the actual the hardwired information that is research proven, worked well, and has a large sample size that is true, the truth, versus like you said, versus what someone told me.
Yeah. Absolutely.
Well,
And, I think we normalize unwell so much in our
mhm.
country. And instead of, although it's common, it doesn't mean that it's actually healthy, right?
No, no.
So,
I always tell people you never want to be the average.
yeah,
The average is overweight, stressed, depressed, anxious, and angry. Let's not be the average.
yeah,
No. But it takes the work and the education and the learning and the patience to understand what the truth is versus going just like again off of someone else said, or I read this, or he said, she said. It's okay, what is the real knowledge? How do I become my best doctor for me, for my body, for my time, maybe having a baby or not, so I can keep my family healthy?
yeah, absolutely. It's not a quick fix. I think we're also
Oh.
used to just getting a pill. We feel a certain way, take a pill, it's going to make you feel better.
Mhm.
And that was one reason I got out of conventional medicine, is that's very common, and it's not an alignment, right? So it's not going to be a quick fix. It's really focusing on all of these tiny pieces. The things that you do today is going to impact your tomorrow, and everything is just building block off each other. And so that's what's going to make those lasting changes as well.
You're making people healthier and happier and having happier families. That seems like a better profession passion than, all right, here's another patient going to be upset because they can get this pill, they can come back a month later and not get better. I'm like, ugh, another revolving door. So
Yeah.
you're helping people long term with their families, and as you do this longer and longer, you're going to see their offspring now have more offspring. Go, hey, you saw my mom so long ago. Can you help me too? They're like, of course I can. You know,
I hope so. That's a goal. I would love that. It would be incredible to help
hey,
people along those paths.
you're doing a phenomenal job for a population that sometimes is not heard because they're a small population, obviously, but need the knowledge that they're not getting from their healthcare provider. They're told, okay, if you're not getting pregnant now, let's do the hormone therapy. That doesn't work. Let's do in vitro. Versus there's all these other steps you need to backtrack to realize why a thing's not working properly. Why are things not in your expectation, maybe not the right expectation? Let's backtrack all the way back and now build out the building blocks of getting you healthier first.
Yeah. Yeah, and that's why I think it's such a disservice. I think there's so much that people can do and couples can do for their own health, as well as just to boost their fertility in that time frame while they're trying to conceive. If you aren't getting pregnant within the first year,
No,
like a year's a long time to be trying to get pregnant and to continue to
that's
see
a lot of
negative
work. That's a lot
pregnancy
of
tests.
energy.
It
Oh,
is. So I think in a lot of emotions that go into that, and then the second guessing of, well, why can't I get pregnant, and what's wrong with me? And for all the listeners out there, nothing's wrong with you. You
good.
aren't broken. You have a body. You aren't your body, right? There's so many things that you can do to help improve that, but it's not you that's broken. So, I think
Good.
our
I like
system.
that. I like the way to, as a good takeaway, because you're helping understand. I need to find a different way to look at this picture. This is not just one perspective. I have to look a different way. Now, if we're giving someone an avenue to find hope, to feel good about themselves, and have a happy, healthy family as a couple, not just as the one person. So it's the combination of them helping husband and wife, girlfriend, boyfriend, helping each other, not just on their own.
Absolutely. Yeah.
Good, good. Anything
Yep.
else we may have missed for our first show, Miss Aimee?
I don't know. Just know that if you do get the diagnosis of, say, unexplained infertility, just dig deeper. Find someone else who's going to look into this deeper for you and with you. Don't hesitate or be afraid to ask questions.
Mhm.
Be your own advocate when it comes to your own health. And if you aren't getting the right answers or questions, they're not being listened to, find somebody else. I'm happy to help you along this path. If not me, then reach out to someone else. There's a lot of other functional fertility practitioners out there right now. But there's a lot that you can do, and don't take just it's unexplained. Keep trying or jump to this if that's not in alignment with how you feel and how you want to go about your fertility.
And I think a lot of it is sometimes doctors in general, they don't like the words, I don't know. I can't help you. So a lot of it is unexplained means hasn't been told to you yet. So there's answers out there. And again, on the show notes, we have your website, cozellihealth.com. You're North Carolina, but you can be on Zoom and phone calls all day long, correct?
Absolutely. Yep. See clients
Perfect.
worldwide, not localized to here. So, yeah.
Thank you. Thanks for being on the show, and I appreciate your knowledge because you're giving, again, women hope, couples hope that may not have been given before. Instead of paying thousands of dollars on in vitro and artificial insemination, allows them to get that answer for their health to keep themselves healthy first. All right, so I'm going to end the show now. We'll go to the back stage area, and thank you guys for watching. Appreciate it, all your watchers and watchers to be.
Thank you, guys.